If you or someone in your household has a pre-existing condition, this might be one of the most important videos you watch before joining a health share or switching to a different one. Because here's the deal, health shares can be a great way to save money on your healthcare, but when it comes to pre-existing conditions, there are some really important things that you need to know up front. So in this video, I'm going to break down exactly what a pre-existing condition is and what that means for you on whether you should join a health share or not. So let's get into it. So first of all, it's important to know that health shares are not health insurance, and so they have different guidelines, especially when it comes to pre-existing conditions. And what a pre-existing condition is to a health share is basically any sign or symptom that you had before joining a health share. Any medical issue that you might have had, that could mean a diagnosis that you've received from a doctor. If you've been diagnosed with something, you've maybe received treatment for it, or maybe you've just had symptoms of something in the past, couple of years. Even if you didn't know what it was at the time, you never went to a doctor about it. If you have any signs or symptoms before joining a health share, that's considered a pre-existing condition. So why does that even matter? Well, health shares will allow you to join them even with pre-existing conditions. With health shares, there is a phase-in period of sharing when it comes to those pre-existing conditions. This is how it typically works. In the first year of membership, there is absolutely no sharing available for pre-existing conditions. That means the health share community is not going to share or pay for any medical expenses related to a pre-existing condition. Now, in your second year of membership, you will get a small amount of sharing available to you. Now, obviously, depending on the health share, that could be $15,000 or up to $25,000 after you've paid your IUA or member responsibility amount. But that's just specifically with your pre-existing condition. In year 3, that amount increases a little bit more. In year 4, it can increase and have a cap or a limit, or at 4 years, they might not even consider it a pre-existing condition anymore. So it really depends, again, on which health share you join, but usually at 4 years it's capped, or they say, okay, we're not even gonna consider that pre-existing anymore. Now, there are some exceptions. For example, some health shares will allow conditions like high blood pressure, cholesterol, or diabetes. They might not even consider that pre-existing or handle it like it's pre-existing if it's well managed through lifestyle or medication. Now, something like cancer, heart disease, or recent major surgery, those will fall under the pre-existing condition rules. Now, this is important to understand before you join, because if you need immediate care for something that you already have, a health share might not be the right fit for you. So if you have a pre-existing condition, should you even join a health share? Honestly, it really depends on your situation. If you have ongoing medical needs that require immediate attention, such as a current pregnancy, then a health share probably isn't the best option for you right now. Now, if you have a condition that is well managed for years and you mostly just need something for the unexpected medical events, a health share could still be a fantastic way to save money. If you want to learn more about pre-existing conditions, I really recommend looking at the health shares member guidelines. They're really going to spell it out for you in those member guidelines about the pre-existing conditions, how it works, and that specific health share, how they're going to handle everything. And that is something I highly recommend that you do before you join a health share, just to make sure that you have appropriate expectations on what to expect with the health share when it comes to your pre-existing conditions. I definitely want you to have a great health share experience, and this is probably going to be the best thing that you can do, is read those member guidelines. Until next time, I'll see you on the next video. Bye, guys.